Hello, everyone. Thank you for joining us today. Welcome to the Avexia webinar series. Our topic for today is Empowering Women's Breast Health Journey with Biological Breast Cancer Screening. Today, we have the distinct pleasure of being joined by an exciting guest, Audrey Steier, who will be our presenter for this webinar. Audrey Steier, MMS, PAC, is a board-certified physician assistant specializing in breast health. Audrey earned her Master of Medical Science in Physician Assistant Studies from Wake Forest University School of Medicine and completed her breast certification through the American Society of Breast Surgeons. She is passionate about community breast health education. Knowledge is power, and her goal is to empower each individual to take control of their health. While there are certainly risk factors for breast cancer beyond the individual's control, she focuses and counsels on what someone can do. Outside of medicine, Audrey enjoys spending time outdoors with her family, traveling, and perfecting her chocolate chip cookie recipe. Without further delay, I will now turn the webinar over to Audrey.
Hello. Thank you all for taking time out of your busy lives to be here today and learn about Auria's biologic breast cancer screening. Auria designed this screening as a tool to empower women in their breast health journey. Hi, I would like to introduce myself. My name is Audrey. I'm an Auria breast health educator. I also practice as a physician assistant breast specialist. I'm extremely passionate about breast cancer awareness as I feel it can truly save lives. Here is our agenda for today. We'll go over what is ARIA, why ARIA uses tiers. We'll go through the testing process and then test results and what to do next. So ARIA is a supplemental screening test. And supplemental means that it should be used in addition to other types of breast screening, such as self-breast exam, visits with your healthcare provider, and breast imaging. The ARIA test looks at biomarker proteins in tiers, specifically S100A8 and S100A9. A biomarker is a measurable indicator of something happening in the body. So in the case of ARIA's test, it is an indicator of breast inflammation. I want to make sure you are aware that ARIA is not a genetic test. Hereditary cancer genetic testing is looking at DNA, whereas ARIA is looking at proteins. I also want to make sure you are aware that ARIA is not a determinant of future breast cancer risk. ARIA provides a real-time snapshot of breast health and could change over time. So this picture demonstrates the best use of ARIA's test. Again, it's a supplemental screening, so should be used in addition to monthly self-breast exams, visits with your healthcare provider, mammography or other types of breast imaging, and for some individuals, that hereditary cancer genetic testing may be an important piece as well. You may wonder why ARIA uses tears instead of other body fluids such as blood or saliva. So, tears are an ultrafiltrate of blood plasma and have a very high concentration of low molecular weight proteins, such as A8 and A9, which we are interested in. Um, because the tears are an ultrafiltrate of blood plasma, they don't have many of the other larger molecules that take specialized equipment to process. So the processing of tears is much more cost effective as well. And lastly, tears are easy to collect at home. So you don't need to draw your own blood. You can easily collect tears and submit your own sample. So let's talk about the ARIA testing process. So through ARIA's HIPAA secure platform, you can order your test kit. After it arrives, there will be instructions on how to activate the kit And then you'll be asked to complete a health profile. There will also be a video on how to collect your sample. So the test strip will stay in the eye for about 5 minutes. Then it will be placed into a tube, and there will be instructions on how to return that sample in the box back to Auria's lab, Namita. Processing takes about 7 to 10 days, and then a result will appear on your result portal. Once you have your results, you have the opportunity to schedule a community consultation with a breast health educator, such as myself. So during that breast health education session, we will talk about results and what to do next, as well as some additional breast health information. But for this presentation, I just want to remind you that Auria provides a current snapshot of breast health. And so it is still important to continue your usual breast screening, such as monthly self breast exams, imaging, and visits with your healthcare provider. So on the ARIA results portal, you may receive one of these two results. A negative result means that ARIA did not find an elevated level of proteins A8 and A9 in your tears. And ARIA has a 92% sensitivity, which means we can be pretty confident in that negative result. A clinically significant result means that a high level of proteins A8 and A9 was detected in your tears. But it's important to note that this is not a diagnosis of breast cancer. The ARIA test has a 58% specificity, which means there could be quite a few other reasons for a clinically significant result, such as a breast fibroadenoma, a breast cyst, or even breast infection or recent surgery. So, what does sensitivity and specificity mean? The sensitivity of the ARIA test is the probability of having a positive or a clinically significant result in individuals that we know have breast cancer. So, if we were to test 100 women with breast cancer, about 92 of them would have a clinically significant ARIA result, which is pretty good for medical testing. And ARIA specifically chose an algorithm that would have a low false negative rate. The algorithm ARIA uses includes the levels of those A8 and A9 proteins and an individual's age. So then when we talk about the specificity of the ARIA test, we're talking about the probability of having a negative test in individuals we know do not have breast cancer. So if we tested 100 women we knew did not have breast cancer, 58 of those women would have a negative ARIA result, but 42 of them would still have a clinically significant result. So again, there are other reasons that breast inflammation can occur and a clinically significant result may be found. ARIA does not distinguish between a malignant or a benign finding or cause of inflammation. So in order to reduce that false positive rate, we recommend taking ARIA when you feel your healthiest. Auria is thrilled to be partnering with Evexia to empower women in their breast health journey. Have a wonderful day.
For any questions or issues, you may contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Audrey, for this informative presentation. Thank you again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics and Namita, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.